What's the difference between family medicine doctors and internal medicine doctors or internists? I think a lot of you guys might be wondering about that. You've asked me this question, and I know for years before getting to medical school, I wasn't quite sure what the difference was and how someone would choose whether they go to an internist or a family doctor. Now, you guys know I'm a family doctor. I'm your friendly family doc, Dr. Jen Caudle. I'm a board-certified family practice doctor. I see patients. Yeah, I've been in practice for 13, maybe going on 14 years or something like that. Crazy how time flies. I was born to be a family doctor. It is my heart and soul because I love what I do. I love the diversity of patients and ages and families I get to see and conditions, et cetera, et cetera. But that's what I'm going to talk to you about, which is the differences between internal medicine and family medicine and which one you should see. And by the way, there are a lot of similarities. So let's start with the similarities, okay? So to become a family practice doctor or an internist, you first go to college and then you go to med school and then you do a residency. The residency is probably what you guys are used to seeing on shows like Grey's Anatomy and Scrubs and so many different shows that talk about and feature what it's like to be a resident. Typically long hours, lots of patients, it's stressful, it's tough, it's hard, lots of growing pains. That's what residency is. And the length of time that you're in residency, that's really the on-the-job training for being a doctor. See, when you go to med school, it's like the book stuff, right? You're in class, you do get some on-the-job training, but you're a medical student. You're not actually a doctor yet. When you do your residency, that's when you're actually working, apprenticing, so to speak, as a doctor, and you're training on the job. So some similarities is that family medicine residency is 3 years. Internal medicine is 3 years as well. Now, both family medicine and internal medicine have components of residency that are hospital-based and what we call outpatient-based, meaning you're seeing patients in the office, not in a hospital. But typically, internal medicine doctors see more patients in the hospital. And we often, they are sometimes internists only work in hospitals. Most of their training is in the hospital, although they do outpatient training as well. Family medicine, we train in both places, but we are typically thought of as more outpatient docs, although there are family doctors that work solely in the hospital too. And let's see here, both of us can specialize, both family medicine doctors and internal medicine doctors can go on to do extra training after the 3 years. Internal medicine doctors become, they become all sorts of things, nephrologists and cardiologists and all sorts of things like that. That is a pathway for that. Family medicine, we can specialize as well, but it's just not the same specialty offerings. And most of us as family doctors work as family doctors. Now, let me tell you the big difference, okay? The biggest difference between a family practice doctor and an internal medicine doctor in terms of you is that family medicine doctors, we see people of all ages. That's right. We see people from birth to death. We see babies. We see kids. We see adolescents, teenagers. We see young adults. We see adults. We see elderly folks. Internal medicine doctors see adults only. That is primarily the biggest difference and what you should keep in mind when you're choosing a doctor. Now, we can both handle pretty much all of your medical concerns for the most part, but the question is the age and which one you fall in. So it's okay to go either to an internist or a family doctor. When we say family medicine, oftentimes we as family doctors literally do treat whole families. I have families where I see the aunt and the uncle and the kids and the grandparents and the cousins and whatever. And it's not that internists don't do that either, but remember, they only see adults. So there's a lot of crossover. We are very similar in a lot of ways, but the biggest difference besides the specialty options is the age groups. That's right. So internists to adults only. Family practice doctors, we do birth to death, and we see all ages. So I hope that's helpful for you to know just a little bit about some of the differences. And of course, this is not all encompassing. I'm sure some of my doctor colleagues will say, oh, but you didn't mention this, or there's also this. And I'm sorry if I left some things out, but I wanted to give you sort of a 50,000 foot overview of what the differences and some of the similarities are. Guys, I'm Dr. Jen Caudle. Hey, write in the comments whether you see a family doc or if you see an internist. I'm just curious, because once again, you can see either depending on your age. I am Dr. Jen Caudle. If you have not subscribed to my channel, I invite you to do so and click the little bell for updates. Guys, I'm Dr. Jen. I'll see you soon.